I would now like to invite Sri Amitabh Kant, an Indian Administrative Service Officer, Chief Executive Officer of NitiAayog, to provide the keynote address.
Mr. Raj and Mrs. Kamala Gupta. Let me also welcome Stephen Klinsky and Maureen Sherry. Despite the fact it's an absentia, but their contribution is highly appreciated. Dr. Sunil Kumar, the Provost of Johns Hopkins University, our distinguished panelists for the day, Dr. Balram Bhargav, Dr. Amitabh Gupta, Dr. Gagandeep Kang, Dr. Srinath Reddy, Dr. Naresh Trehan, all of whom have so significantly contributed to India's public health care, and particularly during the COVID-19 pandemic. Let me at the outset thank the Johns Hopkins University for its great effort in developing this Gupta Klinsky IndiaInstitute. Johns Hopkins, to my mind, is the ultimate in public health, and there could have been nobody better than Johns Hopkins. This is a great effort, and on behalf of Government of India and Niti Aayog, I take this opportunity of thanking Johns Hopkins for collaborating with us and making up a unique institute in India. It was really fascinating to hear Mr. Raj Gupta on his journey from the small districts of Uttar Pradesh to United States and to heading a Fortune 500 company and to go on to do creative things and wanting to give back to the country in such a unique manner. So both to Raj and Kamala Gupta, thank you very much for giving back to the country and contributing in such a unique manner. I would also take this opportunity of thanking Stephen Klinsky and Maureen Sherry for partnering, both of you, in building this unique institute. This Johns Hopkins Gupta Klinsky Institute is, to my mind, a felt need. It will fill a huge vacuum in India. Public health is critical for India, and we in government and we in Niti Aayog in particular will be delighted to work in partnership with this institute. Public health is critical in India because I've been a long-term believer that India needs to grow at rapid pace of 8 to 9% per annum over a 3-decade period, year after year, year after year, to be able to lift a very young population above the poverty line. This growth on a sustained basis over a long period cannot be achieved without a huge improvement in our social indicators. My own experience of Kerala for a long period has been that its improvement in health outcomes, in learning outcomes, and improving nutritional standards lays the foundation for a sustained growth over a long period. Unless and until we don't improve these indicators, merely carrying reforms in the field of economy or introducing foreign direct investment or opening up economies for greater investments will not sustain for a long period. Actually, India has grown at high rates of 8 to 9% for relatively short periods of 5 to 6 years after the post-91 reforms. The challenge is to sustain this over a 3-decade period. And that really requires a huge amount of effort to improve health outcomes, learning outcomes, very radically, and to my mind, nutrition, of course, is very, very critical. Our own experience of COVID-19 and the catastrophic human, social, and economic toll of the pandemic has demonstrated that protecting health is critical for economic security. Just as economic development and health developments are inextricably linked, so too economic resilience depends on very resilient health systems. It is not possible that without good, strong public health systems, economy can grow and flourish. Quite often we in government fall into the cycle of panic and then forgetting. Frequently, this has been observed in past pandemics, that we just forget once the pandemic is over. And therefore, increased investment in emergency preparedness and response has all too often been followed by rapid disinvestment and actual neglect, which weaken health systems and undermine economic resilience. The reforms, therefore, must integrate health emergency preparedness and response systems into universal health coverage efforts. And these must be based on primary health care and essential public health function approaches with reorientation of investment and resources towards primary health care. And I am a great believer in primary health care, and these reforms will actually help build all hazards health emergency preparedness and resilient health systems. They will actually in the long run generate a very substantial return on investment in terms of healthier populations, economic resilience, and equitable social development. So we in India need to invest in whole of society governance with meaningful engagement with communities and civil societies, the private sector, and that should be the real role of the government. Universal health coverage and health security are actually interdependent, and they are complementary health goals. And a strong and resilient health system provides the foundation for both. Health systems actually are built on a multi-sectoral, whole of society approach and are key to effective management of all types of health hazards. They enable existing capacities to address increased health needs and underlying risks. They ensure sustained delivery of high quality, safe essential health services even during pandemic and emergencies, and build back better through the recovery period, making use of the various lessons that we have learned during the pandemic. But this would require a very proactive, very system-wide integration of universal health coverage and health security efforts at both the primary, the subnational, the national, and the community level. Over the past decade, we in India have actually, especially during the last 5-6 years, have implemented a wide range of reforms in the health sector to expedite the progress towards universal health coverage. The government has actually shown a commitment to achieving sustainable development goals and providing universal health coverage for all its citizens by 2030. In 2018, the government launched the Ayushman Bharat Yojana, which actually adopts a continuum of care approach comprising of two interrelated components. It focuses on 150,000 Ayushman Bharat Health and Wellness Centers at the grassroots level, catering to preventive primary care. And this, to my mind, was the more critical aspect of it. And Ayushman Bharat Pradhan Mantri Jan Arogya Yojana, which was actually driven by two of my colleagues who are here, Hindu Bhushan and Dinesh Arora, in its initial period. And this is the world's largest publicly funded health insurance scheme. This covers 500 million Indians, which is more than the population of USA, Europe and Mexico put together. It is totally cashless and paperless, and you can be from Bareilly in Uttar Pradesh, you can be traveling to Tamil Nadu, you can carry your health insurance with you. We are also, as I mentioned, transforming the 150,000 sub-centers and primary health centers into health and wellness centers. And our aim is to provide comprehensive and quality primary care. These health and wellness centers, which almost 81,000 are functional, will provide a broader range of healthcare through the essential package of services, including screening and treatment for non-communicable diseases and chronic communicable diseases like tuberculosis. The PMJAY is also path-breaking in many ways. As I said, it's cashless and paperless. Access to services for the beneficiary at public and private impaneled hospitals for more than 1,500 predefined health benefit packages. More than 25,000 hospitals have been impaneled, with over 26 million hospital admissions and over 130 million PMJAY cards generated within 3 years of scheme implementation. The scheme has led to increased access to health services and medication, timely treatments, improvements in health outcomes, standards of healthcare services, and patient satisfaction. It has also contributed in very significantly reducing out-of-pocket expenses. One of the key initiatives which we have taken in government is to now launch the Ayushman Bharat Digital Mission. And this aims to leverage information technology to strengthen the accessibility and equity of health services, including a continuum of care through a citizen-centric approach. Many of you are aware of the platform approach that we have taken in the JAM Trinity. Over 1 million Indians are biometric, their bank accounts, their mobile telephony. Many of you are aware of the Unified Payment Interface, which has enabled Indians to transact through their mobile telephones, which has enabled cash flow lending, which has enabled people to do personalized investments, etc., all through mobile telephone, all digital. And this has been a technological leapfrogging of India in many ways. And therefore, the digital mission aims to leverage information technology to strengthen the accessibility and equity of health services, including a continuum of care through a very citizen-centric approach. This would focus on National Health ID to allow seamless flow of health information with patient consent, a healthcare professional registry with a comprehensive repository of healthcare workforce in the country, and a health facility registry including details of hospitals, clinics, diagnostic labs and imaging centers, pharmacies and other health service providers, and electronic health records with patients' longitudinal medical history. This would be transformational in many, many ways, much like we did the COVID, which was totally digital and which enabled India was the only country in the world which had a vaccination drive covering a vast segment of its population, over 1 billion, through a digital movement, through a digital app, COVID. No other country in the world could do this. I was recently in the United States and everything was based on paper, and in sharp contrast, India's vaccination drive was entirely digital. And therefore, creating a national digital health ecosystem will support the country's progress towards a universal healthcare in an efficient, accessible, inclusive, affordable, timely and safe manner. We are also pushing for the improvement of infrastructure in rural areas through the Pradhan Mantri Ayushman Bharat Health Infrastructure Mission, which is a pan-India health infrastructure strengthening scheme. This is in addition to the National Health Mission and a part of the Ayushman Bharat initiative, and therefore we'll be augmenting health facilities for treatment, establishing integrated public health labs for diagnosis of diseases, and expanding the existing research institutions that study pandemics at the grassroots level. India's ongoing efforts make complementary investments to strengthen primary health care and reduce barriers to hospitalization totally in line with globally recommended best practices on health systems, strengthening for universal health care. While the country's health sector has made significant progress, it has to continue its journey towards universal health care and address critical challenges. And there are many, many challenges for improved health sector resilience. And I'm sure that in the days to come, the Gupta, Klinsky Indian Institutes and the Johns Hopkins University will play a very critical role in meeting all the challenges that we'll be confronted with. And we in Government of India will continue to work in a very close, very constructive and a positive partnership with the Johns Hopkins Gupta Klinsky India Institute. Let me take the opportunity of thanking Johns Hopkins University and congratulating Raj and Kamla Gupta and Stephen Klinsky and Maureen Sherry for their immense contribution towards it. Thank you very much.
Thank you, Mr. Kant. We are inspired by the work of NitiAayog, and we thank you for your able leadership, specifically in the areas of pandemic preparedness and universal health coverage, the areas in which you mentioned the government is working in great stride to address through efforts like Ayushman Bharat. And we're excited and honored to work with the government to support these efforts. I would now like to welcome to the stage our esteemed panelists,